Our bodies are intricate networks of wonders, and the circulatory system stands out as a testament to nature's brilliance. At the heart of this system lies a vast network of blood vessels, responsible for transporting life-sustaining blood to every nook and cranny of our being. Imagine a complex highway system with arteries acting as superhighways, veins serving as avenues, and capillaries forming intricate alleyways, all working in perfect harmony to ensure the delivery of oxygen and nutrients while whisking away waste products. Arteries, with their thick muscular walls, are tasked with carrying oxygen-rich blood away from the heart and towards the body's tissues. Veins, on the other hand, equipped with one-way valves, ensure that deoxygenated blood flows back to the heart for replenishment. Capillaries, the tiniest of blood vessels, form an intricate web within tissues, facilitating the exchange of oxygen, nutrients, and waste products between blood and cells. This continuous loop, powered by the tireless pumping of the heart, is essential for life. Every cell in our body, from the tips of our toes to the top of our heads, relies on the circulatory system for its survival. Disruptions to this delicate balance can have far-reaching consequences, impacting our health and well-being. It's a symphony of flow, pressure, and exchange, a marvel of biological engineering that keeps us thriving. Blood pressure, a term often heard in medical settings, is essentially the force exerted by blood against the walls of our blood vessels as it courses through our circulatory system. This pressure is a vital sign, much like our pulse or body temperature, providing valuable insights into our cardiovascular health. Imagine a garden hose with water flowing through it. The pressure of the water against the hose's walls is akin to blood pressure. Blood pressure is measured in millimeters of mercury and is expressed as two numbers: systolic and diastolic pressure. Systolic pressure, the higher number, represents the pressure in your arteries when your heart beats, while diastolic pressure, the lower number, reflects the pressure in your arteries when your heart rests between beats. Maintaining healthy blood pressure is crucial for overall well-being. When blood pressure is consistently too high, it can lead to a cascade of health problems, including heart disease, stroke, and kidney failure. Conversely, extremely low blood pressure can deprive the body's organs of essential oxygen and nutrients, leading to dizziness, fainting, and in severe cases, shock. Think of blood pressure as the driving force behind the delivery of oxygen and nutrients throughout your body. Just like a car needs the right amount of air in its tires to run smoothly, our bodies require a balanced blood pressure to function optimally. Blood pressure is a dynamic physiological parameter influenced by a myriad of factors, some within our control and others beyond it. Understanding these factors is crucial for maintaining healthy blood pressure levels and mitigating the risk of cardiovascular disease. Our diet plays a significant role in shaping our blood pressure. A diet high in salt, saturated fat, and cholesterol can contribute to hypertension, while a diet rich in fruits, vegetables, and whole grains can help lower blood pressure. Similarly, maintaining a healthy weight through regular exercise and a balanced diet can significantly impact blood pressure. Stress, a ubiquitous aspect of modern life, also exerts a powerful influence on blood pressure. When we experience stress, our bodies release hormones that cause blood vessels to constrict, leading to a temporary spike in blood pressure. Chronic stress can keep these hormone levels elevated, contributing to persistently high blood pressure. Other factors such as age, genetics, and certain medical conditions can also play a role in blood pressure regulation. While we have limited control over these factors, adopting healthy lifestyle habits can significantly mitigate their impact. Hypertension, or high blood pressure, is often dubbed the silent killer because it often presents no symptoms in its early stages, yet silently wreaks havoc on our cardiovascular system. Defined as a blood pressure reading consistently above 140/90 millimeters of mercury, hypertension affects millions worldwide and is a major risk factor for heart disease, stroke, kidney failure, and other serious health conditions. The danger of hypertension lies in its ability to damage blood vessels over time. The relentless force of high blood pressure against artery walls can cause tiny tears and injuries. These injuries trigger an inflammatory response, leading to the buildup of plaque, a hard fatty substance within the arteries. This process, known as atherosclerosis, further narrows and hardens arteries, restricting blood flow and increasing the risk of blood clots. The consequences of untreated hypertension can be dire. Heart attacks occur when blood flow to the heart muscle is blocked, often due to a blood clot, forming in a plaque-filled artery. Similarly, strokes result from a disruption of blood flow to the brain, either due to a blockage or a rupture of a weakened blood vessel. Early detection and management of hypertension are paramount to preventing these life-altering complications. Regular blood pressure checks, coupled with lifestyle modifications and medications if needed, are crucial in combating this silent threat. Atherosclerosis, a slow progressive disease that affects arteries throughout the body, is a major contributor to cardiovascular disease. It's a complex process that begins with damage to the inner lining of arteries, often due to factors like high blood pressure, smoking, high cholesterol, and diabetes. This damage triggers an inflammatory response, attracting white blood cells and other substances to the site of injury. Over time, these substances, along with cholesterol, calcium, and other cellular debris, accumulate within the artery wall, forming a plaque. Plaque buildup narrows the artery, restricting blood flow and making it harder for the heart to pump blood effectively. As the disease progresses, plaque can harden and become less stable, increasing the risk of rupture. When plaque ruptures, it can trigger the formation of a blood clot, completely blocking the artery. If this blockage occurs in a coronary artery supplying blood to the heart, it can cause a heart attack. A blockage in an artery supplying the brain can lead to a stroke. Atherosclerosis is a silent disease in its early stages, often presenting no symptoms until a blockage occurs. Early detection and management through lifestyle changes, medications, and in some cases surgical interventions are crucial to preventing serious complications. In the face of advanced atherosclerosis, when lifestyle changes and medications alone are insufficient, angioplasty emerges as a beacon of hope, offering a minimally invasive approach to restoring blood flow in blocked arteries. This procedure, also known as percutaneous coronary intervention, involves navigating a thin, flexible tube called a catheter through the circulatory system to the site of the blockage. A balloon at the tip of the catheter is then inflated, compressing the plaque against the artery wall and widening the narrowed passage. In many cases, a stent, a small expandable metal mesh tube, is also inserted to provide structural support and prevent the artery from re-narrowing. Angioplasty is a highly effective procedure for treating blocked arteries, relieving symptoms such as chest pain, shortness of breath and fatigue, and reducing the risk of heart attack and stroke. Recovery time is typically short, allowing patients to return to their normal activities soon after the procedure. While angioplasty is a significant advancement in treating cardiovascular disease, it's not a cure-all. Lifestyle modifications and ongoing medical management are essential to prevent the recurrence of blockages and maintain long-term cardiovascular health. Our cardiovascular system, a marvel of biological engineering, deserves our utmost care and attention. Understanding the intricacies of blood pressure, the dangers of hypertension and atherosclerosis, and the available treatment options empowers us to make informed decisions about our heart health. Simple yet powerful lifestyle modifications can significantly impact our cardiovascular well-being. A balanced diet, rich in fruits, vegetables, and whole grains, coupled with regular physical activity, can help maintain a healthy weight, lower blood pressure, and improve cholesterol levels. Avoiding tobacco smoke and managing stress are equally crucial in mitigating cardiovascular risk. Regular blood pressure checks are essential, especially for individuals with risk factors such as family history of heart disease, diabetes, or obesity. Early detection of hypertension allows for timely intervention, preventing or delaying the onset of complications. Remember, knowledge is power. By understanding the intricacies of our circulatory system and adopting heart-healthy habits, we can empower ourselves to live longer, healthier, and more fulfilling lives.